to everyone tuning in tonight, thanks for joining us for what is a roundtable to have a conversation about healthcare. With all that's going on around New Mexico and around America with COVID-19, in addition to healthcare being more affordable and accessible to everyone, regardless of the zip code that you live in, making sure we're fighting to lower prescription drug prices, making investments with mental and behavioral health, all the work that we need to be doing in oncology as well, something that matters very much to our family, sadly with the loss of my father who lost a bout with stage 4 lung cancer, but the specialty and the work that Dr. McAneny does in all parts of New Mexico. I had an honor to actually shortly visit with Valerie before Cindy introduced me to her, the work she's doing as a nurse, so it's great to be with her. Dr. O'Keefe, to meet you for the first time tonight. And Matt Probst, who I actually went to high school with, junior high, elementary school, we went to Powaka, and he's doing incredible work in the city of Las Vegas now. We'll introduce them here in just a moment. Just wanted to share everyone a little perspective and introduce myself for those that I've not met before tonight. My name is Ray Luján. I'm honored to serve as your United States representative at the 3rd Congressional District of New Mexico, and I'm your candidate for the United States Senate. So I hope that I can earn your support as well. There's so much at stake this election cycle, and what's been encouraging to me is the urgency that people across New Mexico that you're sharing with me and that you're feeling. So thank you for the work you did with the record turnout with the elections for the primary here in 2020. We have incredible candidates up and down the ballot, and we're hoping to partner with you to make sure we have record turnout in New Mexico in November 2020. Growing up, I'm 4th generation on a small farm here in Nambe, New Mexico. My parents, my mom, Carmen Luján, she retired after 33 years from the local public school district. My father was a union iron worker, also served on the county commission, state representative, and was the Speaker of the House. You know, Dad would get up every morning to be able to get to that job up in Los Alamos National Laboratory as an iron worker. And what we didn't know is decades later, my dad would be diagnosed with cancer because of exposure on the job to toxic chemicals. And it was real frustrating because Dad followed the rules. He did everything right. He wanted to fight for a better life, and he still had a lot of living and giving left in his heart. But it was troubling because what it showed me is that people that follow the rules and did everything right, when there's not worker protections, they're the ones that suffer. But I also saw something pretty incredible, and it was the support that came in from across New Mexico, families and friends, people that I'd never met before, that offered support to my mom and to my brothers and sisters and even myself. And it showed me how strong our New Mexico family is and the importance of community and coming together and having each other's backs, even though we may not know one another. It helped me better understand that we are all in this together and that there's so much in front of us to make sure that we're helping our loved ones, friends and neighbors, or folks that we don't even know. That brings us to tonight's conversation. The work that I was proud to do around the CARES Act, which provided more support to hospitals, to physicians, to first responders, mental behavioral health specialists, and investments in our communities, recognizing that everyone that needed to get a test and have access to a test around COVID-19 would get a test for free. That was actually a fight to begin with. Some of my colleagues didn't want to support that provision, but ultimately we were able to come together in a bipartisan fashion to make sure everyone could get a test. And we still need more tests, right? We don't have enough in New Mexico or across the country. But also in the HEROES Act, which is sitting on Mitch McConnell's desk, we passed the HEROES Act out of the House. Mitch McConnell's refused to take it up. In the HEROES Act, we go a step further, not just supporting more testing, more support for our hospitals, more support for rural health clinics and those that are on the front line. But we go on to say that if you have medical expenses surrounding your care for COVID-19, those should also be covered. You should not have to suffer or worry about getting care because of this national pandemic, this global pandemic that has hit every community across New Mexico, every community across America. And so much more work to do. I was proud to work with Matt as well, with Matt Probst and the work that we did, providing more support with addressing addiction and the legislation that I'm proud to have been a part of and author many provisions in. It's just the beginning though. we've not solved this problem. And we have to acknowledge there's a problem in our community that families are facing if we're going to come together to address it. Working together to rebuild the mental behavioral health system that was dismantled by Governor Susana Martinez and her administration. And Governor Michelle Luján Grisham is working diligently to build that back up, but we still have a long way to go. So with that, I'm going to introduce our guest this evening and open this up to a conversation about healthcare, COVID-19, rural healthcare, oncology, mental and behavioral health well-being. Really open this up to a comprehensive conversation as well. So let's start with an introduction of Dr. Barbara McAneny, who's an oncologist, a hematologist, and former president of the American Medical Association, one of our very own from here in New Mexico. Next, we have Valerie Arellanes Jose, who's a registered nurse in pediatrics. And then we have Dr. Ruth O'Keefe, who's a retired orthopedic trauma surgeon and a member of the Corona Crushers, which is a multidisciplinary group that works to develop our COVID response and care for those most vulnerable to this virus, including our Native American population and those experiencing homelessness. And then finally, Matt Probst, who is a physician's assistant at El Centro Family Medical Health. He's the director there, and he's a chief quality officer and serves as the New Mexico Healthcare Workforce Committee member as well. So with that, I'm going to first turn this over to Dr. Barbara McAneny to make some opening comments, and then we'll hear from each of our panelists, and then we'll turn this into a little Q&A. Look forward to that portion as well. So Dr. Barbara McAneny, the floor is yours.
Thank you very much, Representative, soon-to-be Senator Ray Luján. I can't wait for that day. And it's a great honor to be allowed to present what we're doing to help with this COVID crisis. So my practice is New Mexico Oncology Hematology Consultants, and we work in Albuquerque and in Gallup, and everyone in New Mexico knows how devastating this has been for our Gallup patients, for all of the people of that city where it's about 1 in 37 people are positive for COVID. So New Mexico Oncology, we are an independent private practice. We are not funded by anything other than the work we do. But we decided early on in this that it is our duty to our patients and to our community and to our staff that we need to stay open because cancer doesn't wait for COVID. And we know that if our patients go to a hospital and are exposed to COVID, cancer patients have a far higher chance of dying of COVID than other people. And so we felt strongly that it is our duty to our patients to be there for them, to continue treating them, to provide the resources for them to be able to stay healthy and stay out of the hospital. And we also felt it was our duty to our community. We know the hospitals are overwhelmed right now with COVID patients. We wanted to keep our patients, our cancer patients, out of the hospital so the hospitals could focus where they need to right now, which is on the COVID patients. We also felt that we had a duty to our staff. We have about 180 employees, and we knew that many of our employees live as two-paycheck families, like so many people do. We knew that some of our employees who work with us have spouses or significant others who have lost their jobs. So we decided that we would make a $3 an hour increase in their pay, as we call it the family COVID support pay, so that during the duration of this crisis, because of the unemployment, that our people would be able to come to work. They would be able, and they have, I am so proud of our employees. They have really gone the extra mile. We're screening everybody, we're checking everybody, we're seeing our patients, and we've not had any of our employees get COVID. Thanks so much. So hopefully that will continue. But we also recognize that there are a lot of people out there in the community who are afraid to go get any kind of health care. And we worry about that because with cancer patients, if they're having symptoms and they're sitting home and they're not getting these things checked out, they're not going to their primary care doctor because that practice is closed and saying, "Doc, what's this lump growing in my neck?" Or they're not going in to get their mammograms or their colonoscopies, et cetera, that cancer will be growing. So we just set up a program where if people are concerned about cancer, they're worried their symptoms they're having might be, they can call us up. We'll do a telemedicine visit for them so that they can explore those symptoms with one of our trained people. And then if they're doing okay, and we think it's not a cancer-related thing, we will tell them it's safe to wait for their primary care doctor. If they think that something that could be cancer, we will bring them into our safe non-hospital facility so that we can take care of it. And we think that's another way that we can serve our community. So we've been here since 1987. We are proud to serve New Mexicans. We will continue to serve the people that we care about, our patients, New Mexico people, and make sure that we do the right thing for them, and that we recognize that we are all in this boat together, but we also know that some people's boats are a whole lot bigger than other people's boats. Some people are in yachts and some people are in little leaky canoes. So we also have a foundation that is helping our patients with the non-medical expenses of having cancer. And we're giving out food bags, and we're giving out help with paying people's mortgages or their rent so that our patients will be able to not only survive their cancer and avoid COVID, but have a life to go back to when this is all over. So we're really committed to this, and so proud to be working with Ben Ray and seeing him advance in this, because we know that we share so many of the same ideals that he personifies.
Well, thank you, Dr. McAneny. And it was incredible to work with you and still to work with you as we do everything we can to strengthen access to care, especially for brothers and sisters, friends and neighbors who have been diagnosed with cancer. And you reminded me the importance of telemedicine as well as food security. You know, it's all aspects: transportation, food security, telemedicine, being able to get in touch and stay in touch with your providers and get access to that healthcare. So thank you so much, Dr. McAneny. Next, we're going to hear from a registered nurse in pediatrics, and that's Valerie Arellanes Jose. Valerie, the floor is yours.
Thank you so much, Representative Ray Luján. And as we stated, hopefully, you know, in the future. So yeah, I did want to talk a little bit from my perspective. It's good to see a lot of different healthcare workers out there representing their field. I really appreciate that. I'm a nurse at Carey Tingley Pediatrics. I used to work an adult surgical specialty unit called 4 South. So I kind of have adult and pediatric experience. I've been a nurse for almost 5 years now, so still a newbie. But basically we, you know, take care of anywhere from newborns to 18 years of age, even, you know, medically fragile kids, I guess you could say, but they're technically, you know, in their early 20s, mid 20s. Obviously those kids with cerebral palsy or any kind of brain disorder will follow for a little while. Obviously not ready to make that adult step yet, that transition. So yes, we've all definitely been seeing the challenges that COVID has been presented to not only the healthcare community, but our community as a whole, New Mexico, the entire nation. It's been extremely difficult for everyone. There's a huge transition, right? Right now, you go to any hospital or clinic or urgent care, wherever, you're gonna get screened and you have to wear a mask, which I think is a good step. That's a big change that's been occurring. We've been limiting the number of patients, parents, family members, etc. coming in due to the pandemic, and we won't let anyone in if they have really anything going on, right? You can have a cough, you're not coming in. Fever, definitely not coming in. And, you know, beforehand, it was not the case unless, you know, they need to go to the RCC, the Respiratory Care Center, where they will get tested. They don't want them walking straight into the hospital and going to a very, very vulnerable unit and potentially exposing all the people that are already in the hospital and sick. We don't need them to be exposed to COVID or whatever else they have. We've done a lot of different things, new protocols, new transitions, new everything. I'm sure you guys that work in the healthcare field know, each week it changes, right? It's been a big, big roller coaster, but that's something we have to do. We have to be very open to the change, because this is once in a century that this has been happening. Last time this happened was, I believe, in 1918. So we do have to take those major steps. As you know, we've canceled a lot of elective surgeries, any appointments that need to be, that can be delayed, aren't necessarily urgent or emergent, those are going to be delayed. And, or they can do a telemedicine, like Dr. McAneny was saying. We're trying to do a lot of telemedicine, as I'm sure you guys have been hearing, and I'm sure you've been offered an appointment via telephone if you had an appointment coming up. So that was definitely a big transition for all of us. We also had to make more rooms in the ICU, right, at UNM Hospital, which is where I work. We didn't have all the beds for our regular patients we see, in addition to the COVID patients, right? So they had to expand. They brought floor nurses to help with the ICU and brought some clinic nurses to help with the floor, because we can't stop patient care, right? There's still gonna be traumas and emergency surgeries and all of those patients that need to be seen, and they can't be turned away. And thankfully, I feel like they haven't been, but it's definitely been a higher capacity of patient load that the hospital is used to, which is a big transition. I know they've been opening up more units because of that. Now, there's a few things I want to talk about, sorry. The hospital has definitely lost money due to the elective surgeries. But I think the biggest thing is the strain on the PPE and the resources. That's where a lot of us are at. You know, are we gonna have enough masks and gowns, etc., for the future, especially for the second wave we've been talking about? I think a lot of nurses and doctors are, I'm not gonna lie, a little bit scared about that. And I did wanna talk to you about that, Representative Ray Luján, you know, about whether we're gonna have enough resources or not, because nationwide, everyone's demanding a lot of it, right? So the path to make high quality healthcare accessible to all, I want to kind of chime in on what the previous healthcare workers were saying, that, you know, going to the ER, the urgent care, it's already a high cost for a lot of people, which is why they won't go. Now with COVID, I think they're too scared to go, because one, you had the cost, right, the affordability. And now you have COVID, where a lot of people are scared they're going to get exposed, which is why we began screening and, you know, potentially preventing those patients from coming into the main side and going to like the respiratory care center. But, you know, I explained to a lot of parents, like, hey, you know, if your child is experiencing these symptoms, they definitely need to go to urgent care, which we've been trying to take those steps to prevent exposure. And trying to just explain the safeness of the hospital, despite everything going on. And we're doing our best. I know it's definitely a timid time right now. But many people obviously wouldn't go because of accessibility and affordability. Now with COVID, like Dr. McAneny was saying, it's a little bit hard and scary for some patients. We're trying to not make that another prevention for them to get the care they should receive. Now, why am I supporting Ben? A lot of us are on the same page here, but we have a lot of similar values and views that coincide together. We both believe in supporting medical research and evidence. Of course, you know, with everything going on with COVID, hopefully a new vaccine will be produced in this process. And I think that's extremely important. Like we were talking about the opioid crisis. The opioid crisis is huge in nationwide, especially in New Mexico, hits really is close to home. So I do want to commend you for that, for supporting legislation to combat the opioid crisis. That is, to me personally, it's a huge, huge step. and supporting behavioral health and mental health services, especially now. I know a lot of people have been going through more than they were already going through. I think that's a big thing we need to keep our eye on as well. Thank you so much.
Valerie, thank you. And, you know, you talk about the importance of the vaccine that we are all waiting for and that everyone is fighting to get developed right now. One of the big conversations around the vaccine is, once it's developed, will everyone be able to get it?
Right.
Or is it only going to be people that have the financial means to afford it? And people that don't have financial means to afford it, are they going to be left out? And that's unacceptable.
Right.
Everyone in the United States that needs this vaccine needs to be able to get this vaccine and not be left out. So I appreciate what you're saying about that, Valerie, about making sure we're able to get it out, and what Dr. McAneny presented about making sure everybody is able to get access to quality, affordable healthcare. But when that vaccine comes, everyone needs to be able to get it as well. And then the importance of PPE, as you said, look, this is one of the areas that I have the biggest concern with President Trump. First, as we know, President Trump's response was not immediate out of the gate, and he was reluctant to come forward to admit that this was a growing problem in the country. And then when we were hoping across America, all of us, that the president would invoke the Defense Production Act to bring every resource together in the United States to manufacture as many tests as were needed, all of the PPE, so, you know, the face coverings, eye coverings, gowns, protective hand, whatever it is that all of you as first responders need, and physicians and providers, nurses, that they would be made available. But it didn't happen. As a matter of fact, one of the biggest problems that existed, and it's still a problem, is governor after governor, hospital after hospital, each one of you that has your own practice, you were trying to procure as much PPE as you could for your needs. And what was happening is, as states were having to bid against other states, they would secure more PPE, and then FEMA would come in and not allow the state to get it because they would intercept it. So rather than the federal government coordinating Defense Production Act, making all the PPE that was needed for everyone across the country, and then the United States government coordinating the distribution of all the PPE, that's not happened. It still needs to be corrected. Fortunately, the CARES Act and some of the other bills that have been passed by Congress and signed into law provide more financial resources for PPE and for states, but we still are not where we need to be in the country. So I appreciate that, Valerie. It is needed, and more support for hospitals, clinics, physicians, hospitals, not just to make up for that lost revenue, but to make sure we have expanded telemedicine and more support. So thank you for that as well. Next, we're going to hear from Dr. Ruth O'Keefe. And again, I love the organization that she's a part of, the Corona Crushers, reaching out for helping the most vulnerable in our communities, in our Native American communities, combating homelessness and helping folks. So Dr. O'Keefe, the floor is yours.
I work with a group called New Mexico Medical Reserve Corps, and we had been doing healthcare at the big homeless center on the west side. And then kaboom, the virus hit, the pandemic. And as you know, we had no national coordination, no national guidance, no guidelines, no processes. Our national pandemic guidance had been obliterated. So we organized ourselves, put the pieces of the puzzle together. The partners include the city, the State Department of Health, and now we get into all the volunteers that Medical Reserve Corps, we have Presbyterian on board, UNM is on board, the city's on board 100%. Heading Home, who organizes the West Side Shelter, First Nations, Albuquerque Healthcare for the Homeless, and many other partners. So we put together the pieces that included screening everybody, every time they come into a homeless shelter, and then isolating those that are under investigation, testing them. Once they're tested, they need to be isolated. We've set up a total of 6 hotels. By the end of July, we will be down to 1 hotel. We have put 600 citizens through the hotel isolation protection system. About 300 of those have experienced homelessness. We initially removed those who were most medically vulnerable, our seniors and people experiencing homelessness with many comorbidities, and we isolated them at the community centers, which were emptied out at the time. Not a single isolated senior has contracted COVID. And out of those community centers, almost all of the women are now housed. And the men, I hope, will be housed. When we finish in July, we'll be down to 1 wellness hotel, I hope, depending. Our systems are in place, our protocols are written, we're ready to go back up in a heartbeat. We have a provider on-call system, which has been 24/7 access. Now we're winding down to 8 to 8 access for answering questions. And it's just been a real gratifying job. We have kept our most vulnerable people safe. That hasn't happened in other congregate living situations. Didn't happen in our prisons, didn't happen in our for-profit halfway houses, but we've done it with a very vulnerable population.
Dr. O'Keefe, I can't thank you enough for what you did, especially for some of the most vulnerable amongst us in the communities that we call home. You know, we're looking now at coronavirus cases climbing dramatically. Florida reporting the highest cases in any day since this all got started. Here in New Mexico, we're seeing a decline right now, but you know that was not easy, and there were a lot of sacrifices by people all over New Mexico. But our governor made some tough decisions early on, all through the lens of how can we save people's lives? How can we prevent death? And we've still lost too many loved ones. But I know those tough decisions, but experts like you and people that are so generous, like each one of the panelists that are here today, thank you for making that difference. And Dr. O'Keefe, you raise also the importance of PPE and the shortage that existed from the beginning, as Valerie did as well. And on top of the lack of federal coordination and direction to all of you on the front lines, we now see what I'll call crooks out there with price gouging and also selling PPE that is not PPE, that is actually harmful to the providers on the front line. Recently, there was a case, and this is something the New Mexico delegation is doing everything we can to get to the bottom of. There was a contract given to a former Trump White House staffer. It was an 11-day-old company, like a $3 million contract to Indian Health Services, to IHS, who procured PPE for New Mexico for providers. Well, the PPE wasn't of the quality that was needed for providers. It wasn't real. And so with all that you all are going through, you shouldn't have to worry about the quality of the PPE that you're procuring or even having to fight to get it. It should all be available. So I appreciate that, Dr. O'Keefe. Thanks for the work you're doing as well. Next, we're going to hear from a classmate, someone that I've known for a good part of my life, but someone that has committed his life to helping others and making sure that there's more support for mental and behavioral health support, access to primary care in rural communities, but especially making sure that there is a conversation and action, most importantly, in and around the addiction challenges that everyone faces. And this isn't something that discriminates. This is something that can hit any family across the country. So Matt, I want to thank you so much, and the floor is yours, sir.
Thank you, Ben. Yeah, I mean, we've been fighting for a long time. COVID's just the new enemy, but you know, trying to protect the underserved. So, you know, for those of you that saw the Providers documentary, it kind of tells that story of rural healthcare in America and the underserved, and El Centro Family Health, which is a safety net for rural and underserved communities across 7 counties of northern New Mexico. 2019 was an interesting year for me. You know, it was a lot of travel across the country, speaking to try and bring awareness to our plight of this injustice, this great injustice of a lack of resources. We're not underserved. We serve our patients. You just heard, you know, we serve them with everything we have. We're under-resourced, and we need resources. So at the end of 2019, after traveling more in 1 year than I traveled my whole life, you know, I came home, you know, with this hope that this film was going to make a difference. And it was, you know, all these trophies on the wall, the PA of the year and the Rural Mental Health Provider of the Year and the Primary Care Provider of the Year, and all these trophies on the wall, and no, you know, it's like horns on the wall. You know, I'm a hunter, but no meat in the freezer, no food on the table for our communities. It broke my heart. It made my stomach sick. You know, it was like, you know, badges of honor on a, you know, combat veteran that then came home and was told, now go off, here's your medal, and rah, 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 let's take some pictures, and now be homeless. And that wasn't okay. And so to start off 2020, we started working here locally, collaborating to say, how do we, it's what Ben's been saying, how do we get 100% access for everyone? And not just for healthcare, because it's all healthcare. It's what we talk about with social determinants of health. So we have a program called 100% Community in New Mexico that Ben supports, and many people support, and really trying to activate and mobilize to fight diseases of despair. Talking about substance use disorder, talking about depression and suicide, talking about childhood trauma, and things that we've personally experienced, and that we need to stop. And so we started mobilizing, and it's what's being said here, working together to pool our resources and weave together our resources for 10 vital services, not just behavioral health care, medical, dental care, food we heard about earlier, transportation, housing we just heard about. And then we call those survival services, but thriving services. So we're talking about job training and youth mentorship, which is my passion, and parent supports and community schools, and, you know, really, really doing things differently. And then COVID hit, and it changed everything, including my face. I think Ben's probably the first time he's seen me since high school without facial hair. But when you wear an N95, you can't have facial hair. So that's just a little thing. But, you know, luckily we had this huge collaborative to shift over and say, let's fight COVID. And within El Centro, just our team has been amazing. You know, resources for testing, you know, across rural New Mexico were tough. And then as the Northwest lit on fire, and what was happening there is just such a tragedy, you know, our New Mexico resources needed to go there. So what were we going to do? We needed to take care of ourselves. And so working with our partnerships, Secretary Kunkel asked if I would serve as her designee to expand testing and response in northern New Mexico. And so El Centro stepped up, and 12 testing sites and 3 mobile units across 24,000 square miles. And, you know, from Roy to Coyote to Embudo to, you know, for all our people, and access at home for folks. You know, if you don't have a car, you can't get there. Telehealth's awesome if you have a phone. And if you have an Obama phone and it's out of minutes, it doesn't do you much good either, you know? So it's about trying to get those accesses to those resources to our community. And so as we did that, you know, it wasn't alone. And so our hospitals kicked in, and our sister community health centers kicked in. And in 7 counties, we went from 12 testing sites to 18 rural testing sites and 5 mobile units, and coordinating with our public health offices and our hospitals. And, you know, now El Centro doing over 1,500 tests in our little tiny communities. And all of us together, you know, we're over 12% tests per capita for our population in our 7 counties, and we're not done yet. We need more. And, you know, that's what it's about. Why do I support Ben? Because we need resources. It's not, we go way back, but it's not about that. It's about going forward together for everyone, for 100%, because it's not right. You know, being poor shouldn't mean that you're 15 times more likely to get COVID. than if you're rich. And it just pulled the veil back. And we should have fixed these resources a long time ago, and the time is now.
That was powerful, Matt. I appreciate that. You said something that really caught my ear, and you said it's not about doing everything just so that you can survive, right? It's not about surviving. It's about having a system in place and infrastructure so that people can thrive. And all that encompasses healthcare, where, yes, if you get diagnosed with a chronic disease like cancer, you want to be able to go see the very best, like Dr. McAneny, and get in. If you get diabetes, you want to be able to get into the best doctor. But what's happening around that, right? The importance of Maslow's hierarchy, not living in a food desert, or in parts of New Mexico where now during COVID-19, all that every one of us heard was wash your hands, wash your hands. What if you don't have running water? Not just to wash your hands, but to drink, to prepare your food, to bathe. We have systemic challenges that we all have to work on to address and keep fighting. And Matt, you talked about the importance of those rural clinics. Here in New Mexico, we're a large state geographically. And you know, some folks, you have to travel 30 minutes just to get fuel. Some people have to drive more than an hour just to get fuel. And so what about to get to a clinic or to see a doctor, and closing that digital divide, or even that phone divide, as you said, so critically important. Thank you for driving that. And if you all haven't seen it, what Matt was referring to with that film, a documentary filmmaker followed him around. It was a PBS special. You can find it online as well. And I'd encourage you to watch it because it's tough to watch, but it'll call you to action. And so just make sure that you get a chance to tune in. So a couple questions that I have, and they've been submitted by some folks, but I'm also going to ask you some others. There's been a whole conversation taking place right now. We've heard this from Vice President Pence over the last couple of days. What was reported is that Vice President Pence told the governors during his weekly call with the governors across America that when they're asked why are there more COVID cases across America, that their answer should be because there's more testing. Well, I wanted to get your perspective on that, because in New Mexico we have more testing, and we still don't have enough, but we're one of the states that's ahead because of the governor's commitment to testing. Each and every one of you, the work you're doing. Matt, you described what happened to expand it in northern New Mexico to get more testing. But I'm not a doctor, but it seems to me that the reason that there's an increase with COVID cases is because more people have COVID-19. Whether there's more testing or not, and you're catching it, if COVID-19 was on the decline and you had more testing, it would show that it would be on the decline as opposed to the upswing. Do any of you want to jump in, or maybe a few of you want to even offer your perspective? Can you help everyone watching tonight how to make sense of that? Because there's a lot of information coming at people, and, you know, physicians, nurses, PAs, you know, we have experts right here. What are your thoughts? Dr. McAneny, I see you jump in there a little bit. You want to take that one on, and then we'll hear maybe from Dr. O'Keefe, and then from Valerie and from Matt as well.
Right. I think the message of don't test so we don't find any COVID cases so our numbers look better is exactly the wrong way to go. And I applaud you, and I applaud Governor Michelle Lujan Grisham for ignoring that bad advice and following the science and following the data and recognizing that she had to shut this state down as much as she possibly could as early as possible, because that's what's made the difference. The testing is really valuable, but mostly it's valuable to help cut the spread. So we would like to be able to test really everybody with symptoms, everybody with an exposure, because if you can find those people who've been exposed, and you can send them home and quarantine them until their test came back negative. I just found out today that one of my employees who lives with her daughter, who went to one of these parties for opening up, a bunch of people there got COVID. So my employee was exposed to her daughter, who was exposed to the party goers. So we needed to send her home and do testing. So if we didn't test her, you're right, we'd not know if she were exposed to COVID. And there she would be in my practice, exposing my very delicate immunosuppressed patients to more COVID. So the answer is not let's hide the tests and pretend it's not there. The answer is we have to use that very powerful public health tool so that we can track those cases, isolate and quarantine people until we know that they're safe to not transmit this virus. I wanted to comment on your points about the running water and the difficulty that we're seeing in trying to help our incredibly scared patients in our Gallup clinic who have the 1-2 punch of COVID risk and cancer, because they see that. But when you live in a multi-generational home where you have a lot of people there, you're hauling water over an hour and we're telling you wash your hands all the time. You don't have access to masks or basic things. We discover that that is such a problem. And this epidemic has pulled the drapes aside to show so many of the flaws in our healthcare system, where people for poverty and for lack of the resources, much less testing, have such a hard time being able to survive a pandemic like this. We really have to use this episode to restructure a lot of our healthcare system so that we can provide the care to every single person who needs it. So that's your charge when you become senator, is we want healthcare that will provide good care for everyone, regardless of their ability to pay.
Thank you, Dr. McAneny. Dr. O'Keefe, do you want to jump in on any of that associated with, what you've been hearing from Vice President Pence?
Not testing is dangerous. It's the only way we're going to shut this thing down is to test, identify our patients, contact trace, isolate their contacts. We'll never win this battle without that.
I appreciate it, Dr. O'Keefe. Matt and Valerie, I'm going to change the question up a little bit, still on testing, but building off of what Dr. O'Keefe just said. One part of the question is, right now, with all the testing sites in New Mexico, I've seen them on the roadside signs. I've heard this on the radio and the television and read it in the paper. The governor is encouraging people to go get tested. And especially if you're going back to work, the governor is encouraging to work with employers so that their employees can go get tested, right, on a regular basis. Can you talk about the importance of that, number one? And then number two, anything that you can talk about with what Dr. O'Keefe just said, the importance of contact tracing, which I was proud to help with the state of New Mexico, but there was some funding that we were able to include in the CARES package that was a grant that was made to the state of New Mexico to expand contact tracing as well. So if you could touch on the two of those as well.
You first, Valerie.
Okay, thank you. Obviously, this is a very interesting subject to all of us. Yes, I think the testing, especially for obviously those who are exposed and working, is extremely important because, especially healthcare workers and those in areas of public, seeing all these people in public, it's extremely important because you don't know who's walking into the clinic or the hospital or who's walking into the store or, and not being very careful, right? So obviously, the more we know, the better off we will be with success with this virus. The more people we know who are exposed or are infected, the better we are to isolate them, quarantine them, ensure that they're not spreading it like wildfire, which is unfortunately what had been happening in nationwide. And I kind of wanted to touch on New Zealand. I'm not sure if you guys are aware of this country, but they have 0 cases right now because of contact tracing. And I think I kind of wish that we did that early on. I know it was a lot of funding and organization. It took a lot, but I think we would be in a better spot with contact tracing. I think we're trying to do a better job. But I think, early on, like New Zealand did, they have 0 cases and they're, doing, I don't know if you saw, they had a big, I think it was a soccer game recently. We kind of were, following the rules, staying quarantined, not adding fuel to the fire and letting it burn everywhere like a wildfire. I think we'd be a little better off. But I know New Mexico is doing very well compared to many other states. Like you said, we're on a decline. it took a lot of hard work and a lot of sacrifice for everyone to get here. And I pray that we continue, and I'm hoping that we get more into the contact tracing of it.
I appreciate that, Valerie. Like Dr. O'Keefe just said, you know, wearing a mask as well, as you said, is one of the easiest things that we can do, and the most important things. And it's not so much that you're protecting yourself. You're still protecting yourself a little bit, but it's so you're protecting others. So, you know, if you care about your mom, your daughters, your sons, your fathers, neighbors, co-workers, that's why it's important to wear that face covering as well. I appreciate that, Dr. O'Keefe, with that post there. Well, Valerie is answering. Matt, you want to take a little bit of that on? You've been front and center with this testing and expansion there.
It says, you know, the whole thing about not testing is about as ridiculous as, and it's not the first time I've heard it. Well, don't screen for substance use disorder. What are you going to do if they've got it? Don't screen for depression, because what if all these people are depressed? We don't have the resources to handle that. Well, that's the problem. I mean, we need the resources to handle all of those colliding crises. And so, you know, COVID testing is awesome. And thank you, Governor. Thank you, Secretary Kunkel. Thank you, Secretary Grace. It's all about screening, and not just symptomatic and primary exposures, but asymptomatic. I mean, we want a surveillance. Surveillance is scientific for a reason, right? Just like we want to screen everyone for depression, everyone for substance use disorder. We want to screen everyone for COVID if we can. But testing is one thing, and then there goes to the next thing, which is COVID. Expand both COVID testing and COVID response. Because if you just test, I mean, it's like any data. You know, I'm chief quality officer. I love data, but why have data if you're not going to do anything about it? You got to do something with the data, and do it fast with COVID, because every minute, you know, it's that old force times distance over time power. Remember the strength and training, Ben. Power is about the overtime, right? When you're going to be explosive on your strength training, about doing it quickly, and time becomes the most important thing in that equation. And that's the truth with COVID. If you don't respond quickly, rapid response, and now we've got that going in New Mexico too, it just spreads exponentially. And so we have to be able to respond rapidly, and to respond rapidly, we need resources. And absolutely what Valerie said is right. Contact tracing, and now we're getting there, but we want to be able to get on things quick. And we heard our governor say that we cannot be waiting, you know, 36 hours, you know. And that's the nice thing about having rural testing sites also, because it gives you the rapid response too, right? Because if you're testing in Roy, New Mexico, or Coyote, or wherever in those little places, well, you also have mobile units and teams there to respond quickly when one of those tests come back positive, and test, right, you know, that family or that business or that school or post office, whatever it is.
Well said. And Matt, you said something that's important. As Valerie said, with testing, you're able to identify if someone has COVID-19, so that way you can isolate them so they don't spread it. But as you just said, it's also so you can treat them, and you can make sure they get the care that they need. And what happens if folks are worried because they say, well, I can't afford to get the care? That's why that care needs to be covered as well. And then Matt, when you expanded the question, which I appreciated, you're always so thoughtful and steps in front of me. You described the importance of testing, not just for COVID-19, but for everything. That's preventative care. And I'm reminded of the Affordable Care Act, right? Yeah. Insurance companies used to charge you out of pocket to go get a screening, or, you know, if you're going to get a physical or whatever. But now insurance companies can't charge you for that. And that's why it's important, one, to stand up against my colleagues. You know, President Trump, my Republican colleagues in the House and Senate, they're in court suing to undo and to repeal the Affordable Care Act, which we know would expose everyone that has a pre-existing condition, and it would take away all of those protections. But that's a conversation that we'll have maybe with, you know, a follow-up to this another night with everybody as well. But I really appreciate you folks.
Real quick, Ben,
go ahead,
key.
Matt.
I mean, you just hit on such an important thing. I mean, it's colliding crises, and COVID's making all of this worse, including homelessness. So now you need to quarantine, but you don't have a house. And Dr. O'Keefe talked about that, and we need to fix that, right? Transportation, and we need to fix having access to just even a phone, much less internet. Online school is awesome for community schools if that's what we're going to have to do in Google Classrooms, if you have access to internet. all of that. So thank you so much for fighting for us.
Thank you. So there's two questions I want to throw out, and maybe if you could, so I'm going to ask for just one panelist to take one question so I can try to get through as many of these as we can. So the first one that I have that came in live was from Paul, and he's asking, with the decreased access to primary care due to COVID, how have routine immunizations been affected? Who wants to take that one?
I do primary care. I could just say, and Valerie, but I don't know about decreased primary care. We're at 150% of our normal capacity of primary care of medical in El Centro. Dental is down because we had to go down on dental, but we had to expand, and thanks to the resources, again, telehealth and what we have, you got to take everything you have and stretch it as far as you can. So we're up to 150% of our normal visits right now. And we've been, we fluctuated, but, when COVID hit, there was more need. So you needed to provide more access. And, in terms of immunizations, we shouldn't be slowing down. We do things called essential visits. And absolutely. And as we get, again, I hope we have that vaccine, but when influenza comes, it's always bad. And so if we can get everyone immunized for that as well, again, you can't stop doing the other things because of COVID, because everything's getting worse. We have to do everything, and to do everything, we need more resources. Valerie, I bet you're big on immunizations.
I am huge on vaccine, obviously. I was going to kind of chime in from the ped side. We haven't neglected those visits needed, of course, for continuity of care as far as vaccines, 2 months, 4 months, 6 months, 12 months. We're still recommending they come in. We're still recommending to get the vaccines. Now, I did want to touch on parents being resistant or hesitant to come in, and rightfully so. But again, like I said, we're trying to do the best we can to screen people at the front door, and requiring the masks, as Governor Michelle Grisham did, thankfully so in the way beginning. So we have not neglected those patients. We are still recommending they come in. Now, if it's a patient that needs an annual flu vaccine at the end of June, and the flu season is actually technically over, we're not recommending they come in if that's all they need, right? Or if they need one vaccine that can wait a little bit longer, it's actually up to our attending physicians mostly. But as far as routine vaccinations go, we're still seeing them. We're still recommending to come in. But I have seen some parents hesitant to come in. So, we've had to try to convince them to come, or at least come for a nurse visit, which means they can come in like on a different day or time when there's not as many people in the hospital at the same time. But I think that's the only resistance I've seen since COVID has began.
And Valerie, I think you'd agree with this, but if Dr. McAneny or Dr. O'Keefe, if you wouldn't mind taking this one as well. But if parents have a concern with something going on with their children, or anyone who's feeling chest pain or needs to get in, they should go see their doctor or call up to make the appointment, right?
Absolutely. One of our major concerns is we've seen a decrease in people showing up in the emergency department with heart attacks, or people who aren't getting their diabetes managed. And we worry that what that will mean is that those people will get very sick and end up having much more worse chronic disease problems, and then be more susceptible to COVID on top of it. So that's why we've done the things we're doing to try to say, we're using the telemedicine to be able to screen people and help people get back on some of their chronic disease management. That's what 90% of the healthcare dollar is spent on in this country, is chronic disease management. And if we're going to do a good job of that, we need to intervene early and give people again, like Matt keeps saying, we need to give them the resources that they need to be able to manage those diseases and keep themselves healthy.
I appreciate that. Dr. O'Keefe, if you're able to answer this one as well, and then I don't mind jumping in, but working with any of our panelists. Paul Romero asks, does Medicaid and Medicare cover 100% of the medical costs for COVID-19 patients?
I'm not great about billing questions.
Yeah. Matt, why don't you take that one? And then I have another one for Dr. O'Keefe there. You're muted, Matt.
Again, thank you, New Mexico. Yeah, But the key is, you know, again, it's what we just spoke about. COVID's making everything worse. So where do you draw the line? It's not like, oh, you have diabetes, you have heart disease, you have depression, you have COVID, you have, it's multifactorial. Everything weaves together. And so, I mean, that's the deal. But the point goes back to, again, your fight for us, which is access for healthcare for all. And it's the right fiscal thing to do, because there's also a pandemic, an economic pandemic right now, right? And that's a whole nother crisis that's not my area of expertise. But the point is, it saves money. That's what the Affordable Healthcare, Health Act was all about. I mean, the ACA was all about, if you do prevention and you get it at stage 1 and pre-diabetes, then you don't have the high costs of things like dialysis later on. And so absolutely, it is covered. And where do we draw the line? The point is, it should all be covered.
So here's another question that comes in, and it's a testing question. There's a lot of interest in testing, and it's from Dr. Martin Hickey, who is actually a candidate for Senate District 20. He's a great person, incredible candidate, and the kind of expertise that we need in the New Mexico legislature. But he asks, fair distribution of a vaccine is going to be critical. And as he's visiting with constituents across the district, he's hearing anxiety about that. So he's asking what Congress is going to start doing here to research a solution. But do any of you have some ideas of what might happen at the state level to ensure that there is fair distribution of the vaccine?
I would love to jump in on that question. Thank you, Martin, and good luck to you. What we know that copays and deductibles are a barrier to necessary care, as well as being a barrier to unnecessary care, and are just cost shifting to patients. So one of the things that needs to happen when the vaccine comes out is that we need to recognize that this is a national public health issue. It should not be a vaccine where you can profiteer off of it and have pharmaceutical companies be able to get exceedingly rich because everyone wants it. We need to recognize that the people's taxes are helping to develop this, and therefore it should be at an affordable cost, and we should not allow the insurance companies to add copays and deductibles and all of their other machinations they do to shift costs. Because for public health reasons, we can't leave out any segment of the population. We will not know when that vaccine comes out how long you're immune to it, whether it's 100%. None of the flu vaccines are 100% immunizing. They get about 50, 60%, and we figure that's pretty good. So if we leave populations out, then we just have a starter culture. We have the seeds of the next pandemic. So this needs government funding. This needs a national plan to make sure that everybody has access to that vaccine. We did it before when they first invented the polio vaccine. They made it available to everybody. Everybody went out and lined up and got their polio vaccine in their little cup. And we managed to make it so that we weren't seeing kids living in iron lungs. Valerie is way too young to have ever seen that, but and she never wants to. So we really need a national vaccine program from the top down.
Well said, Dr. McAneny. And Martin, what I would share is at least House Democrats, what we included in the HEROES Act is exactly as Dr. McAneny just described. It's to ensure, again, that the treatment associated with COVID-19 would be covered. And we were explicit that when there's a vaccine that's developed, that you're not going to pick winners and losers, such that people that can afford it are the only ones that can get it, and people that cannot are just left behind. That is not right, not with this global pandemic and this national pandemic as well. So thank you for that thoughtful answer, Dr. McAneny. The next question we have is from Tina Cordova. Tina, who is an incredible advocate down in the Tularosa Basin of New Mexico. She's asking a question about downwinders and uranium mine workers. For those of you that are not familiar with the term downwinders, as you know, the first nuclear test on soil in the United States took place here in New Mexico, the Trinity test site, and families were not given any warning. There was a nuclear bomb that went off. Families reported that there was ash on the clothing that they had on their clothing lines. They heard the boom, they saw the flash, and there was never any support given to these families. Congress provided what was called downwind support into other communities across America decades ago, but the very community where the first bomb was tested on American soil was excluded. There's a piece of legislation that I have that I've been working on with many advocates like Tina, some other friends, and uranium mine workers out in Grants as well in Cibola County, called the Radiation Exposure Compensation Act. But the question that Tina has is, do you think downwinders and uranium workers are a special cohort as it relates to infection from COVID and prognosis because of the immune compromise and lung disease? Does anyone want to tackle that?
Yep, absolutely. Lung is the usual point of entry for COVID. And when those have been damaged, there's no question about that.
I appreciate that, Dr. O'Keefe. And that's why we've been making the case that there should also be support for uranium mine workers and downwinders with these bills. And we'll keep pushing. But I just want to thank advocates like Tina and the work she's doing as well. And that's an important question. So it's incredible how quickly an hour goes by, and I ask for an hour of your time. We're now past 7:30, and there's so many questions that have come in that we've not been able to get to tonight. But I'm going to ask just this one last one from Mary Lindsay, which is a question about wearing masks. And we talked about it a little bit, but she asked, is it still required to wear masks in stores, and have concerns with people who are not doing this because some folks have gotten upset about it. But can one of you talk about where the governor is and in the state of New Mexico? Valerie has one there ready to go. And the importance of why people should wear masks again. Who'd like to tackle that? Dr. O'Keefe, and then we'll go to Dr. McAneny there.
It's easy. It's polite. It's thoughtful. It's kind, and it protects others.
So because that was so concise, one more question, because this is clearly from someone that's been traveling and someone that's working, I'm guessing. Catherine asks, with COVID testing, can she be tested again when she returns from an out-of-state 1-week trip? So what do you all have to say about that?
Yes, she should be. We're still quarantining people who are traveling because we're doing so well in New Mexico because of the efforts of our governor and our leadership to keep our state as safe as possible, that we really need to have people test and make sure that they quarantine. And travel is still a risk. You know, I look forward to being able to travel like everyone else does, but it's just too risky yet to sit in a confined airplane with recycled air. So if one person has COVID, everybody has COVID. I'm very worried, and I hope that you will keep up the fight as we are reopening, and our Republican leadership is holding rallies where they're cramming thousands of people into a space. Please don't travel to those spaces and expose everyone to this. I'm very worried that that's going to trigger a second wave.
I appreciate it, Dr. McAneny. So if you're traveling, you want to get tested right away, and you want to self-isolate until you get that test information back. Hopefully it's one of those rapid tests that Matt talked about. There was a question about how quick of turnaround. We have the ability to get results right away now, and so there's no excuse. Go get that test, self-isolate until you get the negative test back. If it comes back positive, make sure that you're reporting right away and getting support to get taken care of. So I'm going to close this out by just asking if you have some last thoughts, but I want you to keep them concise. Any advice that you have to everyone watching tonight, encouraging words to anyone watching tonight, calls to action, and we'll go in reverse order. as we opened up. So I'm going to start with Matt, then we'll go to Valerie, then Dr. O'Keefe, and then Dr. McAneny. Matt?
It's going to take all of us together fighting for everyone. Yes, we appreciate the support from our congressional office. We appreciate any support that we can get. And we are very, very thankful for what we've gotten from the state of New Mexico. It's been great, but it takes us all, every one of us as an individual, in local resources, working together, weaving together. You heard all the stories here of how much we can do if we just all work together for everyone. And that's a movement and a revolution that can change everything. And maybe it sounds idealistic, but it's exactly what we need right now, because at a time where there's more needs than ever before, there's also fewer resources. So let's all work together to take care of each other.
Thank you, Matt. Valerie?
Thank you. I just want to touch on the masks comment, actually. So I noticed a lot of people, are wondering, well, what is the thing behind the masks? Like, why are they so important? Well, I think it's important to know that a lot of the transmission of COVID is through respiratory droplets, right? Through coughing, sneezing, laughing, even just talking. That's where those droplets come out of our mouth. And that exchange could occur, right? So I think it's extremely important to know that the reason behind the mask is to prevent a high percentage of those droplets being expelled into the air and potentially exposed to other people. So, of course, going to the store, going anywhere in public, I know, of course, besides eating and drinking and exercising, you have to wear a mask in New Mexico. And I'm hoping they mandate that in all states. I'm not sure why they haven't done that nationwide yet. I was hoping that they would do that nationwide, because I think it would definitely decrease the cases. And of course, being optimistic during this time, it's extremely hard, I'm not gonna lie, but everyone, I think, has been making huge sacrifices. We're doing a lot of research and gaining information to help prevent the spread. And I wanna thank those, who are continuing to do so and continue to wear a mask, definitely. This thing's not over, COVID's not done. And I think we got to be a little aware of that for sure.
Appreciate that, Valerie. As Dr. O'Keefe said, it's easy and it's kind. So I appreciate that. Dr. O'Keefe, last thoughts.
Take care of each other. Call your seniors. Be kind to each other. COVID is not going away. It's going to be the fourth lane. We learn to live with the influenza virus, seasonal every year. We going to learn to live with COVID.
Thank you, Dr. O'Keefe. Dr. McAneny.
I think this has been a wonderful panel, but I think the message I want to send out to everyone is that science doesn't go away if you ignore it. You can't pretend that things don't exist simply because you don't want to deal with them. And we need national leadership that respects science, understands data, is willing to show compassion, is willing to get in there and say, we care about the people of this country, and we will do everything that is evidence-based and reasonable to be able to protect people. As a cancer doctor, I know that if you don't have your health, you have nothing. You have to have your health. And we need you, Ben Ray, in the Senate, because we need a Senate that is going to enact policies that will show what the science can do to protect every American. So thank you. You have to win this race. It is so important.
Well, I appreciate that, Dr. McAneny. Thank you for those encouraging words. And to each of you, I mean, you're inspirational. You're making a positive difference. You've dedicated your lives to helping others. And you are so unselfish with your time, not just tonight, but every day. And so thank you all so much. To everyone watching tonight, thank you for taking time to tune in and reach out to friends and family. Keep an eye on loved ones, as Dr. O'Keefe said. Reach out to your friends and families that are senior or neighbors. They may not have family around, and please keep an eye on them to keep them healthy. And then the last thing that I'll share with everyone is on Monday of this last week, I also had Valerie with family time. I love it.
Sorry, they came in. They wanted to say hi.
Oh, no, say hi to everybody. I love it. Thanks for joining us. They're superhero mom. on Monday, we had a conversation with some mental and behavioral health experts. And look, these are tough times as well. And the stress that you're feeling, that's part of mental health. Be aware of that. There's some hotlines that we'll also post and we can get out, and I'll put them on our website. But please call in if you need access to any of the crisis hotlines. If there's a national hotline for suicide prevention or suicide crisis if you're experiencing or thinking about suicide, or you know someone that is in that place as well, reach out and get them help. If you're feeling stress and anxiety around all that's happening, you can also reach out to some of the mental health experts here in New Mexico. We have a few hotlines as well, but get some support. And also, sadly, during these tough times, we've heard and we've seen an increase with domestic violence. If you are a victim of domestic violence, please reach out and get that support as well. And you can also share with your primary care physician. If you're going in to get checked, share with them whether you're having mental health challenges or you're feeling that stress or anxiety, or if you're a victim of domestic violence, share it with them and they will help get you support as well. Everyone, remember, we're in this together. We want you to stay involved. This is just one of the important issues this election cycle. And look, you can clearly see who's on your side and who's not. My Republican colleagues, again, the president, they're in court suing to take away the protections that were put in place for the Affordable Care Act. That means pulling back time on helping people that have cancer and diabetes. If you were a woman, because you might someday have a child, before the Affordable Care Act, that was considered a pre-existing condition. And health insurance companies could charge you more for your health insurance. We cannot afford to turn back the clock. There's so much we have to do to come together, to expand coverage, and again, come together as a community in New Mexico. We're one big family. We may have some disagreements like all families do, but in the end, we have the same goals to make sure that we have a healthier community, that we're able to protect our loved ones, and that everyone can go see a doctor when they're sick or they need help the most and not have to worry about bankruptcy because of how expensive those bills are as well. So thank you for tuning in tonight. We look forward to these conversations. To all the panelists tonight, thank you for inspiring us and thank you for making a difference every day. You all have a good night.